I'm Nick Vogelzang. I'm a medical oncologist specializing in chemotherapy, and I've been involved in treating mesothelioma patients for almost 30 years now. So we've wondered for a long time about whether patients should get chemotherapy followed by surgery, surgery followed by chemotherapy, chemotherapy alone, surgery alone. We've sort of looked at the many combinations, and we can successfully give chemotherapy first, followed by surgery. That is my approach in many cases because I've discovered that only about 10%, maybe 20% at most, of mesothelioma patients really are candidates for surgery. The majority of patients with advanced mesothelioma have heart disease or lung disease, or the cancer is outside the expected ability of surgery to cure it. So I generally will tell patients, let's try the chemotherapy. If you really have a wonderful response, then we can do surgery. For the healthy young patient, surgery though should still be considered first. So the question of how old is too old, it always comes up in oncology. And old is physiologic, not chronologic. You can be 70 and be running marathons, or you can be 80 and on the golf course every day. But in general, the cut point is age 70. The risks of surgery go up after 70, and we always have to concern ourselves that a patient really will have unexpected complications after surgery if they're over 70. I counsel the very healthy, the 70-year-olds who are out doing everyday activities and golfing and swimming and hiking, that they probably could consider it. But if they lose a lung at age 70 or lose part of a lung, it makes life pretty difficult. So I'm cautious in that population. So can chemotherapy be successfully done in the majority of patients? And the answer is yes. We showed in the large mesothelioma trial of Olympta platinum versus platinum that the average age was about 63. The average person could tolerate 6 consecutive doses of chemotherapy, and that about 30% or 40% of patients could go on to get additional chemotherapy after the first go-round of chemotherapy. So it's remarkable how well people do with this drug and this drug combination.